Welcome to Summer in Your City, a safe start to your new exercise routine. So today we're going to discuss how to safely begin a new exercise program and prevent fitness injuries. So our speakers today are HSS sports medicine physician, Dr. James Robinson, and HSS physical therapist, Asma Mohammadi. All right, and I will get started. So my first question for you two. So with so many fad workouts becoming popular each year, there's new things that, everyone's trying out. What would you recommend for people who are trying out these new workouts, and how can they prevent injury when starting something new?
I guess I can start. So one of the things with a lot of the fad workouts and things like that, some of them involve very high intensity type movements and movements that people may not be used to doing. So for example, some workout programs incorporate things like powerlifting and things like that. And those are, if that's something that you're not used to or something that you've not done before, improper technique and improper mechanics can be a high risk for injury with those type of movements. And so making sure that you have proper form and that you have the right technique. So usually I recommend for people making sure that you've got a reputable program where you have a good instructor that is trained and knows what, usually certified in strength and conditioning, and is trained in how to instruct you how to do these maneuvers. When you first start the maneuvers, you need to be doing them with very light weight or no weight at all to make sure that you've got the mechanics of the movement down first before you start trying to throw around heavier weight. And also, like if it's a more high intensity kind of jumping type movement based exercise, not weight based, then maybe starting with the modification, not jumping, just doing the stepping part, get the actual movement down before you start trying to speed up or do the higher intensity portion of it.
Yeah, I mean, I agree. I think, if you're picking up on a new trend, or if you're picking up on a new workout, first of all, try to pick something that you find interesting, right? That you find appealing. If you're spending 30 minutes to an hour on an activity, you want to make sure that it's actually enjoyable and that you enjoy doing it. And then set realistic goals for yourself. Say that you just picked up running, right? You're not going to go sign up for a marathon the next month, right? So with these exercises, it's pretty much the same thing, like Dr. Robinson mentioned, is slowly progressing in, right? So for these HIIT workouts, if you're not able to properly do a squat, doing a jump squat is going to be a little more difficult, right? And it may be putting you more prone to injury. So maybe during your warm-ups, whatever the activity is, do a kind of a dynamic warm-up that includes some of the movements similar to the workout, just so you can kind of feel what the movements should feel like. Right, and just listen to your body, right? Listen to your body during the warm-ups, listen to your body during the workout, and also after the workouts.
Completely agree. The other thing that's important is if you have,
definitely.
Oh, sorry. If you have ongoing musculoskeletal issues, or you have had surgery previously, it may be a good idea to talk to your doctor or physical therapist first before starting these exercise programs, and make sure that this is the right exercise program for you. So, because there are certain exercise programs that some of my patients with certain conditions, I don't recommend that they do, because it's going to be too intense on their condition and cause more pain and may even cause more injury. So making sure that if you do have ongoing musculoskeletal issues, that you get that cleared by your doctor before starting into any new kind of workout program.
Yeah, that's a great point. You definitely don't want to do anything that, is not right for your body, or you can't handle. So always good to check with your physician or physical therapist first. My next question would be, you said you recommend dynamic stretching before you start, or a dynamic warm-up. Can you recommend any specific stretches or things that people should be doing before warm-up, just to warm up those different groups? And then also after workout, what you recommend to do to cool down and heal those muscles?
Yeah, I think the warm up generally, it depends on what your mode of exercise is, but just as a general rule, you want to make sure that you're getting a general warm up so that your blood flow is flowing, so that you get your core temperature up a little bit higher, right? So this can be just like walking or biking or like a light jog, just to get your heart rate up a little bit. And then aside from that, it depends on what your activity will be. And like I mentioned earlier, doing a more type of dynamic warm up where the warm up consists of some of the movements that you're going to be doing during that class, right? So if you're doing if you're doing jump squats, or if you're doing, split squats, stuff like that, making sure that during the warm up you can do slow controlled squats or slow controlled lunges to just kind of gauge how your body feels that day.
Yeah, and I think I completely agree. And I think, there's always kind of debate and controversy about which stretching program or warm up program is the best at preventing injury, or do any of them actually prevent injury? Or, there's a lot of controversy with that. The probably current mantra is like that a more dynamic workout stretch, like so more of a movement based stretching program is better before exercise, and the static stretching program should be saved for after exercise, more in the cool down phase. But, like if you have some tightness in an area, like, maybe your quads are still a little tight from the workout 2 days ago, and you're going to be doing, squats and things like that, doing some static stretching of your quads may help work out some of that soreness as well. So, I mean, I don't think that there's a right or wrong answer for a specific type of stretch. But again, I think Asma mentioned earlier, it's listening to your body, so for some people, like they like that static stretching, they feel like it really helps them and gets them loose and ready to go. And if that's you, then great. And other people can't stand static stretching, and they feel like it hurts, and it makes them, stiff and even more sore than they were before. So kind of listening to your body and figuring out kind of what type of person, what you respond to.
Okay, perfect. And I know as well, you mentioned, starting slow. If you're new to exercising in general, or just that particular exercise class, don't do it every single day. Don't not give yourself a rest day. Is there any particular number of times a week you would recommend a beginner do that new workout?
I think again, it depends on, depends on the person, and depends on your fitness level and your activity level and how long you haven't been working out. But generally, I would say, if you're starting a new movement pattern, if you're starting a new activity, maybe start by like 3 times a week, right? That'll give you enough days in between. So you want to make sure that you get at least a day or two rest in between. And once your body feels like it's ready to go again, then you can do the exercise again, right? You don't want to be too sore the next day and then do the same types of movement over and over again.
Yeah, I agree. I think, when we talk about delayed onset muscle soreness or muscle soreness after activity, it can take anywhere from 24 to 72 hours to really develop. So if you're really, really new into working out and you haven't really done that before, let's say that, maybe you haven't done a workout program since college and you're going to start picking it back up now, even sometimes doing the exercise, taking 2 or 3 days off to see how your body feels, how it responds, and then trying it again. If you're really, really sore, then you may need to do that for a few weeks before the soreness. But if you give it 2 or 3 days and you're not that sore, then maybe the next time you could do it just the next, you could do an every other day type thing, and you just kind of have to play by kind of notice that. If you're doing some type of strength training maneuver, you should not do it every day. So you should not strength train on the same muscle groups every single day. You have to give them rest, have to give them time to recover. Now, when you're talking about things like running, more cardio-based activities or yoga, those activities can be done in consecutive days. So you can do yoga every single day. I don't recommend that anyone do one program every single day. I mean, give your body some rest, let it, doesn't mean you can't work out every day, but don't do the same program every single day. Find a new program or something like that, especially if you're doing anything that has any kind of weight bearing or high intensity to it. So things like running, jumping, those kind of things, you don't need to be doing that probably more than 5 to 6 days a week at the most. And if you're running 6 days a week, you need to be an experienced runner to do that. Most runners don't need to run 6 days a week. They need to be running 4 to 5.
Yeah, I agree, right? And it's, the days that you're not doing anything, you don't have to just kind of, sit on the couch and do nothing, right? If you're really sore, say you did a really heavy leg day and you're really sore the next day, this is the first time you went to the gym in a while, right? Maybe spend some time, getting on the bike, going on a walk, doing your foam rolling, doing your stretching, maybe doing a yoga class, right? Just to kind of get your body moving and get things flowing. And that will hopefully get you less sore, right? Because you're moving, it's going to feel less of that stiffness that you feel after being sore for a few days.
All right, great. And that was kind of, one of my other questions was, so I know you said if you're a runner, don't run every single day, or try to switch up kind of the types of workouts that you're doing so that you're not exhausting that muscle group. But if somebody really loves to do Pilates, let's say, is it bad if they do it 6 days a week, or they do it almost every day and they don't really change up, what they're doing? Is that okay?
I think for things like yoga and Pilates, those are probably fine. Those are kind of lower impact activities. They're not high stress in the joint. But certainly, like even within yoga, I mean, you're not going to do the exact same yoga program every single day. So you may be doing different types of yoga or different types of yoga programs that are working different things. Like one day you may be doing more of a chaturanga focus where you're using a lot of arms, using a lot of chest muscles. And then the next day it may be more of a balance type focus yoga, or a stretching type focus yoga. So there's even within exercise programs, there's different classes. And so you can still, while you can do yoga every day, you may not want to do the exact same class of yoga every day. Same thing with like things like Pilates and things like that.
Yeah, I agree, right? Like it depends if you're going to yoga, if you're going to Pilates and it's an instructor that you follow, and if they kind of see that you're doing Pilates 5 days a week, hopefully they can vary that so it can be more upper body focused one day, more lower body focused the other day, more back core focused the other day. And same with yoga, as Dr. Robinson mentioned, right? You can focus the yoga on different parts of your body. You can have different flows in your yoga practice, or even with running, right? If you want to run every single day, vary your runs, right? You're doing interval day one day, you're going an easier day the next day, so that you're not doing the same 7 miles every single day at the same pace.
And that's why also if you're like new to an activity or you're new to exercise in general, like following a more structured program is a good idea until you get used to it. And most of those structured programs are going to vary naturally. So they're going to have that built into the program, so like that, if you decided, I am going to run a half marathon and that's my goal for the year, then find a beginner half marathon program. And it's going to be one where it slowly ramps up your mileage. You do shorter runs, you do longer runs, you're going to vary. You're not going to be running 5 miles every single day, so those kind of things. Same thing with like Pilates. If you're new to Pilates, get into a structured program, and you're going to have days where you focus more on upper body, more days where you focus more on lower body, core, those kind of things. Those can definitely be helpful for beginners. Now, people who are more advanced and are used to that exercise, then they can kind of do that themselves. They know how to they can kind of do those things themselves. But especially in the beginning, following a structured program can be very helpful. But again, always pay attention to your body, because that structured program is made for the average person. That may be,
Okay,
you may need less, you may need more, that may be right. So you always have to listen to your body. If this doesn't feel right, or you're sore, or you're more sore than you should be, then you need to tailor back a little bit.
All right. And another question people might have when they're starting one of these a new workout routine, if they're worried their form isn't correct, so they may, be using gym equipment, or they may be in an exercise class with other people. Do you have any tips for them, how to correct their form, or just make sure that they're, not doing anything that might injure themselves?
I mean, I would say, some of the ways, if you're doing the exercise on your own, mirror can sometimes be a good way of kind of seeing how your body's moving, right? And then we've mentioned this a few times now, listen to your body, right? If something doesn't feel right, right, make sure that you're, changing things up in a way where it feels, good on your joints, but you're feeling like your muscles are working, right? Whenever you're doing any of these exercises, the movements, you should feel like a workout, right? You should feel a muscle burn type of sensation, and not so much like pain in your joints or pain that doesn't feel like a workout pain, right? And then, if you're really new to something and you're nervous about not doing it properly, we have, rehab and fitness professionals for this purpose, right? Get set up with someone who can, show you how to move properly and also assess your form. And this doesn't have to be just for the novice, right? Like if you're a professional athlete, sometimes you still need someone to kind of look at how you're moving and how you're doing things properly, just to make you more efficient. So that may be a route that you can seek.
Yeah, I completely agree. And that's really good advice. As I tell my patients that, you know, exercise shouldn't hurt. So there's a difference between soreness and pain. Yes, you should be sore after exercise. Exercise should be hard. It should not be painful. And if it is painful, then either maybe something's wrong in your mechanics, or maybe that's not the right exercise for you. And so the other, like Asma mentioned, there's, if you're at a gym, there's usually somebody there. There's usually a strength and conditioning personal trainer, somebody there that could help you if you're like, I don't know if I'm doing this correctly, or I don't know how to use this machine. That's what they're there for. Don't hesitate to ask for their help. If you're doing one of the on-demand programs, like one of the video programs, a lot of times there are, like, through that program, you can email the instructor to ask them questions. Sometimes you can even send them videos of you doing the exercise, and they can give you feedback as to, what you may be doing wrong as far as form rise, things like that. And then like, obvious, if you don't have any of those available to you, we have strength and conditioning sports performance people here at HSS. That will be happy to kind of help. And that's what they do. They kind of help get people look, more of a, not so much a physical therapy point when somebody's injured and needs help, but this is more of like a sports performance, like, I don't know if I'm doing a deadlift correctly, or when I do a deadlift, my lower back hurts and I don't think that's right, which it is not right. Your lower back should not hurt when you do a deadlift. That means you're using improper form, or your core is not strong enough to do the deadlift in the first place. So those are things that you can work with those type of professionals to learn how to correct it. Be careful of, like, everybody loves to give advice at the gym. There's always those people that love to go around and tell people how to do the exercise or correct their form. Be really careful of getting advice from those people, because not always is it the correct advice. Sometimes it is, but not always.
Agreed.
All right, and I just wanted to take a second to remind everyone who's watching, please ask your questions in that Q&A button. We'll get to those in a little bit. So my other question is now kind of getting into more managing, if you do have aches and pains from working out. So you mentioned, there's some exercises that are more advanced, or that people should be a little bit cautious of doing, especially if they are new, they haven't been in a gym in 10 years. Are there any specific movements or exercise classes maybe that you would recommend to be cautious of, at least until you get a better understanding of the movements and how to do them?
Well, I can just say from my experience, I see people that come in the most because they injured themselves doing some type of powerlifting maneuver. So things like deadlifts, cleans, jerks, things like that. Those are very high intensity exercises, and they have a lot of very athletic movements. And so if you're not used to doing those, and you're doing those with really heavy weight, then they can be high risk for injury. So again, I recommend when people first start those exercises, they do so with someone who can teach them the proper mechanics on how to do it. Do it with very low weight or no weight at all until you've mastered the movement before you start adding weight. The other thing is high intensity exercises, are like the high impact, like plyometrics, jumping, things like that. If you're not used to jumping, then you need to make sure like that. Like if you can't do a single leg squat, you don't need to be doing a plyo lunge. If you can't do a regular lunge, you don't need to be doing a plyo lunge, those kind of things. So making sure you have the basic movement down first, and then getting into, because also if like that, if the class is doing like jump squats, but for you can barely do a regular squat without being severely sore, then that's good enough. You're getting enough exercise. You're getting enough work on your muscles just doing the regular squat. You don't have to do the jump squats. So do the squats until those seem easy, and then you can start progressing into the jump squats.
Yeah, and I agree. It's more that the faulty movements of the exercise that you may be doing, progressing too much too soon, like not nourishing your body enough, not, hydrating and not eating enough, not sleeping enough, and not taking rest days. Those are things that are going to put you more at risk of injuries. There's not one specific movement that is, say, bad. You just have to make sure you're ready for it, right? You just have to make sure that you're at a point where your body is ready to handle the demand that you're going to place on it.
I will also say in the studies that have been done, there have been some studies that have shown that the more competition-based focused programs are higher risk for injury. And that is probably because, like you get in a class, you don't want to look weak. And so you do more than you really should. Or so again, staying within yourself, paying attention to your body. Remember, everybody is at different levels of fitness. And, so just because let's say that you can't do a pull-up, that doesn't mean that you're not fit. You just maybe have a different level of fitness. You may be able to do something else better than the other people in the class. So exercise and fitness is not a competition. Now, certainly there are things that can like motivate people to get better, and that always can be helpful, when you need that extra little motivation to go that extra little mile. But be very careful of those, because that's usually where people get hurt. People are most likely to get hurt when they're doing movements, when they're fatigued, when their muscles are tired and fatigued. And so if you're really fatigued, if you're tired, and you're doing more than you really should, that's the most risk to kind of get hurt.
Important not to compare yourself to others while you're in the gym. It's about your own fitness. So that's what's important. So Dr. Robinson, what kind of injuries do you often see from people who might have started something new? I know you mentioned a lot of injuries from doing deadlifts and things like that. Mostly people doing those types of things are extremely high intensity too soon. And like, what types of injuries do you normally see from these?
Yeah, so I think with people weightlifting, we see obviously a lot of back injuries, a lot of lower back injuries from weightlifting. Pulled muscles, herniated disc, those type of things. So certainly that is a common thing that happens when you're doing powerlifting and things like that. Again, a lot of times it's due to kind of a little bit of improper form, improper mechanics, or a lack of core strength. So you really don't have the core strength to support the weight that you're trying to push around or throw around or things like that. I think probably one of the more common things I see is a lot of like rotator cuff irritation and tendonitis from doing a lot of overhead lifting when people just really aren't used to it. So again, remember, starting slow, lighter weight, giving your time self-adequate rest in between, especially if you're starting a new program. And then like that lower body stuff, if you're doing like a high intensity program or something like that, and like that, you have trouble jumping, or you have trouble staying in balance when you jump, then that, of course, that's at risk for like knee injuries and ankle injuries and things like that. So again, starting slow, making sure you have the proper mechanics before you start trying to do some of the higher intensity, more athletic type moves.
And Asma, are there certain injuries that you see often, people that might have started a new program coming into physical therapy that they need help with?
Yeah, I would agree. I would say it's been the same for me. I think in the past like year, with everyone being home and you not having access to like heavier weights, so a lot more people are doing like body weight HIIT type exercises. and it's a lot of jumping, a lot of burpees, stuff like that. So I'm seeing more like, like a lot of rotator cuff tendonitis, patellar tendonitis, like tendon issues, and people who've started running because it's easily accessible. So like shin splint type stuff, and muscle strain, stuff like that.
All right, makes sense. So what would be your recommended treatment for someone that has a muscle pull or a strain that they might have gotten from doing an exercise program at home or from running? Would you recommend that they ice it, that they put heat on it? In general, I don't know if it's their leg or their arm, but could you give some basic tips for that, for treating that at home?
I would say, like, because like Dr. Robinson mentioned earlier, like if it's the first time you're doing a workout, sometimes, if you're really, really sore and you have that DOMS, right? Sometimes it's hard to distinguish like whether you're just really sore or whether it's like a muscle pull. So if you're unsure, maybe take a few days, do your foam rolling, do your stretching, do like a lighter activity. If things are not resolving, then that's the time to go see your, physiatrist or sports medicine doctor to kind of, have them assess and see what's going on, and take care of you that way.
Yeah, I agree. And if, I mean, like that, if you had like, let's say like you had a definite strain, like you were doing an exercise, you kind of felt a pop and a pull, if it's minimally swollen, minimally bruised, there's no real deformity of the muscle. Certainly that's something you can probably treat on your own. Typically for acute injuries, we recommend more ice than heat. Heat tends to bring more swelling into the area. So whereas icing kind of helps. The big thing with those that I see probably people make the most mistake with at home is they overstretch, and so they think they're just going to like push past the pain and overstretch, and they actually end up making the strain worse. So you want to like stretch to the point of pain, but you don't want to try to push past it. So like if your calf is tight, you feel like you have a strain in it, you want to kind of stretch it, but when you feel that pull, when you start to feel that pain, you hold it there. You don't try to keep going, because if you keep going, you can actually make it worse and kind of make it more. And then like that, if most muscle strains take usually a week or two to start, usually in a few days to a week, they're feeling better. They may not be completely well, but they're on the track to recovery. And, if in a few days to a week, you're getting worse or you're not getting better, then that's certainly something you need to probably get checked out and make sure that it's really a muscle strain and you don't have a more serious injury. Because there's lots of things that can mimic muscle strains. So, you can rupture a tendon, stress fractures, ligament injuries, things like that can all mimic muscle type pain.
All right, great. Good to know. We need to know when to seek help for our pain and when we can just put ice on it at home. But what are some modifications that people can make to some of these workouts? So whether they have back pain or knee pain, if you have knee pain, maybe squats aren't the best for you. Running's not the best for you, probably. But can you kind of modify some of these workouts so that it would be a bit lighter on the knees or a bit better for the back? Do you have any tips about that?
Yeah. So like when I talk to for my example, my knee arthritis patients, so, who have knee pain. So certainly they can do squats, and they should do squats, because you want to build strength in your quads. You want to build strength in your hamstrings and your buttocks. But, you may not be able to go to as deep. So like you may not be able to go to parallel to a 90-degree squat. You may have to stop it at 45 or 60 and just do kind of mini squats. Certainly, I don't usually recommend like my knee arthritis patients take up like plyometric type stuff. So, like if they're doing a program where they like that, maybe doing jump squats, the modification is to do a squat with a calf raise instead of doing a jump squat, and a lot of these structured programs nowadays have a modifier. So like if you're doing an on-demand class, if you watch, most of them will have a modifier, like someone doing the modification of the exercise, which is usually lower impact, lower intensity. Doesn't necessarily mean it's easier. Doesn't mean you can't get the exact same workout and work the same muscle groups. It's just made for people with joint problems that can't do the high intensity or the high impact type activity.
Yeah, I would agree. And it also depends on, like why you have back pain or why you have knee pain, right? If you say like you fell or something like that and it's contributing to the knee pain, then want to make sure that you're addressing that so you go back to baseline, right? So you get back to a place where you didn't have pain. But if it's something like arthritis or if it's something that you've had for a while and you're just trying to change your activity so that you can still work out, the modifications are a great way, right? You don't want to push through the pain. If you have knee pain but you're still pushing through that squat, you're still doing a really deep squat, you're probably compensating in other ways and using other parts of your body, right? Which you don't want to do. And then again, if you're still unsure, like go see a fitness professional so they can help modify it for you if those classes are just not enough, or if your modification is not enough, right? Or see a doctor, go see a sports medicine doctor, go see a physical therapist and see what is going on, and if there's any ways you can maybe alleviate or decrease the pain, so that you can move a little bit better.
Yeah, and I think that's a great point, and I think you know that's one thing that maybe people underuse a lot utilize when it comes to physical therapy. Our physical therapists are great at being able to help you modify your activity and get you back into the activity that you want to do. And so, like that, let's say that you've seen a doctor and they've told you had knee arthritis, but it's like, I want to try to get back into running, or, something like that, then certainly like seeing a physical therapist, there may be ways that they can kind of help you modify your exercise, kind of get you back into some of the things that you want to be doing. And so it's a great way to kind of get some advice as far as that goes. When you talk about like fitness professionals and strength coaches, strength trainers, they're great at like for the healthy individual to teach them how to do exercises, proper mechanics, work the right muscle groups. But when someone's injured, that's not really their area of expertise, and you really need to probably see a physical therapist at that point in time.
Okay, great. Yeah, these are all great resources for people that are starting their new summer fitness routine. So if anybody else has questions, type them in that Q&A button. And I see we got one question from someone. So this person has scoliosis, and they said, are there specific movements they should do, or maybe movements that might even help with scoliosis?
I think with scoliosis, it depends on where the scoliosis is and how it's how the scoliosis is formed. But generally, you want to make sure that you're doing some sort of mobility exercise so that you're getting some movement in the areas that are really stiff, and also strengthening areas that are from the scoliotic curve. That some of the areas that get a little lengthened, you want to make sure that you're strengthening those areas out. Right. So I would recommend, getting a tailored plan for you. So maybe, seeing someone and seeing exactly where the curvature is, which part of your body needs to be a little stronger and which parts of your body needs to be lengthened and stretched out a little bit more.
I agree. There's no one program that's best for all people with scoliosis. I mean, certainly we know from back pain, we talk about healthy back exercises, and, that's going to be focusing on core strengthening and things like that. And so that's always a good thing to do. But, especially if depending on how severe your scoliosis is, some of those activities could hurt, or cause pain. And so I think, seeing, I'm assuming if you have scoliosis, you've already seen a doctor and know that you have it. So, maybe getting your physician to send you to some physical therapy and talking to a physical therapist about specific exercises you can do to kind of um, help, strengthen and things like that. There's probably not a lot of exercises that, will correct the scoliosis, or, but there may be some that can help delay the progression of it and things like that.
All right, great. I don't see any other questions, but I was wondering, is there any, specific workout equipment that you recommend, or things that people can do at home, since not everyone might be back at the gym yet, that you think would be a good new workout for people to try, or a tool that might help them to work a new muscle group at home this summer?
Well, I think the big thing is that you don't need any equipment. You can get a very good fitness program with body weight only. And so you don't need to buy thousands and thousands of dollars worth of fitness in order to get in shape. You want to work your legs, do body weight squats, do lunges. If you haven't done lunges before and you do some lunges, your quads and your your glutes are going to be pretty sore the next day. You can get a really good workout. The other thing is the bands. That's a great way to the strength bands. That's a pretty simple. They're usually pretty inexpensive. They don't take up a lot of room. So for all, us in New York City, where room, space is at a premium, and, we're in smaller apartments, those can definitely help. You don't have to have multiple weights. You in a little bag, you can have 5 or 6 different strengths of bands that all wrap up.
Yeah, I agree. Like, especially the past year, weights were just so hard to come by. The resistance bands were just a good way if you wanted to add extra resistance to your workouts. And they are like they're cheap. You can get it off of Amazon. They have a variety that you can pick from, right? And the other thing, I don't know if people have used the TRX bands, but those are pretty easy and accessible. They don't take a lot of space. Depends on the doors, though. New York City doors are a little different than doors in other states. So, if it can fit through your door and you can have it access to in your apartment, that's a good thing to have. It can assist you in your squats and lunges, something to hold on to and kind of modify your activities.
Asma brings up a good point with the doors in New York City. Most of the doors in New York City are not your standard size, and the door frames are not your standard size. So things like pull-up bars that fit inside door frames and everything do not always fit inside the doors here in our apartments. And make sure that they are secure, and absolutely secure, before you try to do anything on them. I've actually seen a few injuries early on in the pandemic from people specifically using the pull-ups and door frames where it probably wasn't the correct door frame to fit, and have had pretty significant injuries, one even a broken hip from falling, from the door frame not being secure. So be very careful about those. But if you can get it to fit and it's secure, it's a great way to get some extra exercise without going to the gym.
Yeah, those are some great tips. And I think everyone's going to be very fit this summer with all of this information now. I think that's all we have time for, if there's no other questions. But thank you so much for everyone that tuned in. And thank you so much to our speakers. This was great. Do you have any final words, you two?
Yeah, just one other things. I know we mentioned this in last week's webinar, but I know during the summer, a lot of people like to exercise outside, which is great. Get outside, enjoy the sunshine, things like that. Be very cognizant of the heat. It's very hot, so exercising in the middle of the day when it's at its hottest is probably not a good idea. Try to exercise more early in the morning, later in the evening when it's a little bit cooler, making sure you're staying well hydrated. Again, making sure you're paying attention to your body. If you're feeling hot, if you're feeling overheated, stop, rest, get in a cooler spot, get in the shade, stay well hydrated. Heat illness is a real thing, and it's a very big problem. So making sure that you avoid that as much as possible.
Yes, that's a great point. Definitely with these temperatures this week as well, drinking water is important, and can definitely get fatigued very easily if you're working out outside or in your apartment. So that's great to know. Do you have any last words, Asma?
Yeah, as agreed. Make sure that you're staying hydrated. Take care of your body with the workouts outside in the heat, and have a good summer.
All right. Thank you so much to you too. This is a great lecture, and it'll be on our YouTube channel. We'll send out a link to everybody so you have that. But if you want any more content on overall wellness, you can go to the our website or our YouTube channel, and you can always send an email to us at pped@hss.edu if you have any further questions.